back to another episode of Rehab Now, brought to you by the Rehabilitation Institute of the Caribbean, Winchester MRI, Immune Active Dank, and Almighty Studios. We have Dr. Paula Dawson with us today. She is our rehabilitation medical doctor, and I am your host, Alicia Taylor. Yes. So this week we're going to be talking about that place we complain about the most. Not our side, not our neck, but our back.
Our back.
And we're back.
And we're back
with our back. You know, remember to check out our social media pages for more information on back pain and how you treat it. On Instagram, it's Rehab Institute Caribbean, Dr. Paula Dawson, or Alicia Taylor Music. And on Facebook, it's Rehabilitation Institute of the Caribbean. Our website, rehabcaribbean.com. All right, Doc, where do we start with the back pain? All right, Doc, where do we start with the back? Anyway, I'm thinking of a rhyme, but it didn't. Go ahead, I'm sorry.
Hi, listeners. How are you?
Oh, hey, listeners.
It's good to be back to talk about the back. You think people are going to think that way? Kind of nutty?
I'm sure they do. But
you
you know
listen
what?
to some talk show and them just boring? I don't know any of those.
Not me. I don't listen to boring talk shows. I listen to Rehab Now on Power 106. See what I did there? Okay, great.
Touch me.
Yeah, man.
Nice. So we're going to be talking about the back.
Okay.
And first of all, where is the back?
You know what?
Where's the back? Take one guess. Where's your back?
At the back.
The back of one. Okay, guys, let's be serious. Okay, so your back. Let's talk medicine now. So your back is that part of your anatomy that starts just inferior to your neck and goes down caudally to the tips of your coccyx. So speaking that in English, it starts from your neck, goes down to the thoracic spine, to the small of your back, the lumbar area.
Okay.
Now, when we say back pain, we usually mean lumbar spine. Lumbar, the curve of your back, down the bottom here, and then in between you have the thoracic spine where your chest is, and in the neck you have the cervical spine. So cervical is actually almost like a verb because you have the cervix in a woman. It's really, cervix means neck. So the neck of the womb is the cervix, and then this is the neck, the cervical spine. So you have the cervix of many things.
Not to be confused with the cervix.
Correct. So you have, cervix is more like a description of a neck. So the neck of different things. So your cervical spine, cervix of the uterus. So you have cervical is really a medical term that means neck.
Are you kidding me?
Yeah, man. Medicine sweet, man. Because it's Latin.
No, but I thought cervix was just for woman, like just your cervix.
Me say cervical. Well, cervix is it represents the neck where you enter the womb, right? So that's a part of the so
makes sense now.
Correcto mundo.
Mind blown. All right, go ahead.
Right. So back pain. Have you ever had back pain, Alicia?
Yeah, man.
Yeah, back
yeah,
pain.
Man.
You know, almost everyone will have back pain. This is what the research has shown, that almost everyone will have back pain at some point in their life. The good thing about back pain, but 90% of the time it will go away. The bad thing is that 80% of the time it will come back unless you do something about it. And that's the thing. That's a natural history, they call it in spine medicine.
Come back?
It's come back if you do nothing about it.
The back's going to come back.
But the wonderful thing about back pain is that...
Wonderful thing about back pain?
Yes, is that you can treat it and manage it. I love to treat back pain. I think back pain is one of the easiest things to treat.
All right, let's talk.
If you have a patient who's willing to participate in their management, because you have to work.
But it's so painful, Doc.
It can be. It certainly can be.
So I can understand why someone would want to work them back pain. We can't just lay down and get better.
You see, I love the fact that you brought that up, because there was an article published years ago. It was an award-winning article, and it shows that if you have acute back pain, acute means sudden, back pain, you should only stay in bed for 48 hours maximum, if you have to.
Okay.
You must get out of your bed, because the longer you stay in bed, the weaker the muscles get. Research has shown that you can lose 1 to 2% of your strength per day when you lie in bed, like in the ICU. So after a week, you can lose almost 10% of your body strength.
Stress out now, you're not becoming an exercise. So what that mean for me?
Exercise. Well, you see, you're not in bed. So immobilization, I'm talking about ICU. Immobilization where you're not working.
I'm not bad then. I'm not bad.
But there is a percentage of immobilization, people who have sedentary lifestyle. And so the back pain is so universal. So many people will have back pain as a result of different things.
Okay.
All right? And so, people are going to ask me, where exactly do you call the back? I want to divide it into, so you have the thoracic spine, which is just under, where the ribs, by the shoulder,
right,
down to the small of your back. We call that the thoracic spine. That's the upper back.
Thoracic spine, upper back.
Thoracic spine. And then you have the mid back, and then you have the lower back, which is the lumbar spine.
Yeah.
And then a lot of people will include the buttock area, where over the sacrum, over the buttock. We can't say buttocks on here, right?
Yeah, I mean, we've been saying it. I just did. Oh, no.
But it's an anatomical term. So over the gluteal area, you can have pain there as well. Now, the question is, where is the pain coming from? What is the pain? What caused your back pain back then?
I don't even know. Maybe it's my posture.
And the lack of exercise?
I'm so shady, doc, man.
I know.
And the lack of exercise,
Exercise. All right. So what are some of the causes of back pain? All right. So I like to do things systematically. So you either start from deep inside and you come outside. So the deepest thing that I would want to start with are the intervertebral discs. These are the cushions in between the vertebral discs. Remember, vertebral discs are like oxtail. You ever eat an oxtail? Yeah?
You're not doing this. Really? Oxtail? Go ahead. Teach me.
You know, the vertebrae kind of shaped like oxtail. They actually do.
Oh.
They are, the oxtail is the spine of the cow. Pig's
Oh! No! We are not. Are we?
Uh-huh.
Oh! Oxtail lovers. The horror.
Okay, all right. I don't want to say anything about pig's tail then. But that's tail. Well, anyways. All right, so let's continue. So the intervertebral discs are located in between the vertebrae. And you have the vertebrae that run from the cervical spine, which is the base of the skull, all the way down to your tailbone, the coccyx, right? And they're stacked on top of each other. And so the vertebral discs are the cushion segment.
Okay.
They absorb shock. They allow us to bend. If we had all bones, we would be stiff like a board. We would kind of walk like a robot. But the wonderful thing is that we have these intervertebral discs. And these discs actually are made up of 90% water. And so they're just like a jelly donut. So the disc, imagine you have a jelly donut and the jelly is the middle part of the disc and the dough is the outside of the disc. When people have a herniated disc, the jelly goes through the dough and the red part comes outside. And that is what causes a lot of pain. So you can have an intervertebral disc herniation, a slip disc, or you can also have arthritis in the spine, something called facet arthropathy.
Arthritis is terrible, though.
That's what you said in the last season.
No, man, it's terrible, man. We can't get arthritis in my spine.
You know, did you know you can get arthritis in your ears? We have some bones in our ears, 3 little bones. And you can actually, you have something called pres acoustic. Where you can actually get when
you know my ears?
Yeah, because those, when you, I'm not an ENT, I have some good friends who are ENT surgeons, but, sound travels, but the tympanic membrane, it goes through the eardrum and it goes through and it vibrates through some little bones. And those bones can actually become, because they articulate, they're connected, you can get arthritis in those. So anywhere you have bones connecting to another bone, you can get arthritis. And so you can get arthritis in the spine in a joint called the zygapophyseal joint, also called the facet joint. Right. And so then you can have it from that. You can get ligamental injury. Ligaments are that which connects bone to bone. So you have a whole heap of ligaments in the lower back, and they can be injured as well. After that, the discs or the narrowing of the spine can pinch the nerves. So the nerves are exiting through these little holes called the neuroforamen, and that can cause pain down the leg. And if you come out further, it can be muscular. Like when you're at the gym and you lift up something or you lift up a bucket of water, you can strain the muscle. And so it can be from deep to outside, right? It can even be referred pain. You can actually have back pain from a referred pain from an organ in your belly, like the uterus or the colon. You can get referred pain. Not very common.
I don't understand. What do you mean from my,
Referred pains.
from my belly?
Yes, man. Because pain is art. So you can have referred pain, meaning pain originates from a different site and then it's referred to another site. All right. So right, and so that's the interesting thing about back pain.
Wait, is that the same case with women who have really big breasts? Is that referred and then get back pain? Is that referred pain?
Well,
or that's a
I'm
different
glad you
thing?
asked that, but no, that's not referred
Okay,
pain. It's because the weight of the breast it causes the posture to be more hunchback. We call that kyphotic posture. And then the muscles in the back, they become overworked and sometimes you get a lot of ligamental, musculoskeletal imbalance. And then you get what we call myofascial pain, which we're going to talk about. I
Yes.
love myofascial pain. Well, I don't like it for myself because it can be quite painful.
Because, you
But
know.
myofascial pain is something that another thing that is so common. You know what myofascial pain is? You ever have a knot in your shoulder yet?
You ever see my shoulder? I just bear not this. You know what? Look now, a knot.
Not. All right. And so myofascial pains are areas of the body where you have these little knots all over, where the knots are entangled. The muscle fibers are entangled. So you get these little knots. And when you press them, that knot now can be a trigger. And it can trigger pain referred down the arm, right?
Yes, you told me this already. Yeah.
We did. Right? And so if you go back to lower back pain, you know, when you approach a patient with lower back pain, you really want to know what structure is injured or hurting. That's the intrinsic structure. But then you have extrinsic causes. What do I mean by that? Outside cause, right? For somebody who's always sitting at a desk without, especially during COVID with this new work from home. We're going to do a topic on work from home.
Can't believe.
I know, with all these, you know, meetings. You remember first time you used to have to drive to meetings, so you could only have 3 or 4 meetings per day? No, you can have 8.
It's crazy.
1 8 to 9, 1 9 to 10.
Yeah, and you're just there on the computer, there on the laptop, and it's just meetings.
Right. And so your posture can also, you know, predispose you to back pain. You know, back pain can also run in the family. It can have familial, you know, common things are common, you know, and I believe that is primarily because of the body habitus, which is
Genetics.
yes, and I think that's because of the body habitus, how the body is, the architecture of the body. However, I love back pain because if you understand the back and you can stabilize what protects the back, the core. We're going to talk about the core. And I always love to talk about the core. The core is a 5-gallon bucket. It's really not the abs in the front. We're going to talk about the core.
We're going to talk about a lot of things with the back. It's so much to uncover.
It is.
Yeah, but we're going to have to take a little break.
Yes,
and then we get back to talking about, because you said something about acute, and we want to talk about the difference between chronic and acute back pain. So we'll be back. Stay with us.
Yes.
And we are back with Rehab now, talking about back pain, all kind of back pain, referral pain, familial pain. I go on good. That's your
Right, girl. I like it.
Before the break, we said we were going to talk about the difference between acute and chronic pain. So, Doc, tell us.
I'm chuckling because the last time I said chronic pain, you said, who, chronics?
I did. Oh, wow. I'm crazy.
Right. So chronic. So chronic is from the word chronological. Chronological means time. So chronic means long pain going on for a long time. So a lot of people think chronic is bad. Chronic is not really bad because you can have a mild chronic.
Okay.
This problems. Chronic just means it's going on for a long time. Chronological.
Oh, okay, fine.
Acute means sudden. Just that from an event. So if you have an acute back pain, you just get it. Once it passes, like, the month mark and you're going to 3 months in back pain, we talk about greater than 3 months is chronic back pain. 3 to 6 months and beyond is chronic back pain, right? And so I think before we went on the break, I was about to, talk about the spine and the core, right? We mentioned some causes of back pain by virtue of the anatomical cause. What is the pain generator? Where is the pain coming from? Now we're going to talk about the core. And even before we start talking about anything, we have to understand what the core is. You always hear people say, "I'm going to strengthen my core, forget the six-pack." No, the six-pack is only one side of the core.
Oh.
The core, imagine the core is like a 5-gallon bucket. So the top of the bucket
That is so interesting.
is your diaphragm.
Go ahead and teach me.
You're teachable,
Teach me, because this is good stuff.
Yeah, man. The top of the core is the cover of the 5-gallon bucket, and the bottom of the core is your pelvic floor, your buttocks and the pelvic floor. And then the front of the core would be considered your abs in the front.
Yeah, rectus abdominis and the muscles. Thank you.
Yeah.
Thank you, doc.
She said rectus abdominis. And what's the name of the muscle that comes around from the back? Transversus abdominis.
I was going to say it. I was going to say your transverse muscles.
Transversus abdominis.
Okay, transversus abdominis.
Right. That is a very important muscle. And in the back of the back, the obliques are at the side, kind of at the side. But at the back, you have what we call the paraspinal muscles. Now, the paraspinal muscles are some of the most important muscles in maintaining segmental stability in the spine. And so deep in the back, you have these different muscles called, like you have the multifidi, the rotatories, the iliocostalis, a whole heap of them.
You remember all of these?
Because I love the back.
Man.
I love the back. And so deep in the back, you have all these muscles. And so, when you go to do rehabilitation, these are the muscles that we kind of target when we go to treat back pain. And so, when you have back pain, what you did, we say don't remember what you were doing, but what do you do the first thing?
I can lay down. You hear me? I don't know nothing else to do. Lay down. But then I know, I'm kidding. But so I lay down.
Yes.
But then I know that I have to move. I just don't know how I'm going to move without hurting myself.
Yes.
But I try
Yes.
my best.
You remember what I said the last time? Motion is lotion. You have to move to move. And if you don't move, you won't move. And that's one of the things I tell my patient. If you don't move, you won't move. You have to move and you have to start. Do you remember that acronym for musculoskeletal injury?
Wait, it's not ice. It's not.
ICE is in there.
Rice. So
But there's a P. Price.
Okay.
Protect.
Yes. Protect. Rest. Ice.
Yeah.
Compress. Elevate.
Yeah.
Whoa. Yes.
So whenever you get an acute injury, you usually want to go through the Price routine, right? And so even in the back, even though the back is not somewhere that you can per se elevate, you can, the first thing you have an injury to the back, you want to ice it. Providing you have no other medical injuries, of course, you need to clear anything we're going to tell you about treatment, you have to clear it with your physician first. That's our disclaimer. Right, because sometimes, back pain. Oh, another thing that I can mention from back pain that can cause it, you can have tumors, metastatic disease, and you can have infection. I forgot about that. You can have infection in the spine. Back in the day when we used to have tuberculosis, you can get tuberculosis in the spine. Oh, wow. You can also get an infection in the spine. You can get metastatic tumors from other places coming to the spine. Right. So I forgot to mention though. Right. And so treatment, you want to start. First of all, you want a relative rest. Because if you were in the gym and you did some bench press or whatever, you lift up something and you hurt your back, the first thing you want to do is rest it. You don't want it to be agitating the fibers or the discs or whatever. So you ice, right? And then, I have an algorithm that I go through, which includes one. The first thing is rehab.
Okay.
All right. And so, after you go through the acute state of icing and relative rest, rehab. And for us, rehabilitation has 3 main areas. Physical therapy, one. See, we're going to talk about physical therapy in the back with one of the therapists from the
Rehab Institute of the Caribbean.
in Post Office Mall, Lake and E, right across from Sovereign. I have to plug that. That's where we have our team. And then after that, we look at your lifestyle. Because if we're treating your back pain, whatever we give you in physical therapy, and you're doing your home exercise program, you must do a home exercise program. I tell patients, if you don't do nothing not going to happen. I'll give you the medication, it will help, but the pain is going to come back. So you have to play your part as well. And so we look at your lifestyle. So even if we give you the physical therapy, you're doing your home exercise, and you're sitting at a computer, twisted sideways, or the ergonomic, you remember ergonomics? Yes, the ergonomic setup is not correct, you are going to get the pain again, or it might not improve as much as it can. So that's number one. Number two, medication.
Okay.
And I always want to start with the meds. I always start with the easy stuff first. The anti-inflammatory, like the ibuprofen and the diclofenac.
Man, I know those.
Right, the ibuprofen, the diclofenac. And then you may need, if the back pain is really bad and it comes with spasm, you may need some muscle relaxant.
Okay.
Right? And then after muscle relaxant, if the nerve is being affected, you might need some nerve medication. And I like to use like gabapentin and amitriptyline and some other stuff, right?
All of the triptylins.
All the
got
triptylines. And regular over-the-counter acetaminophen, which is like, or over-the-counter like Panadol or Tylenol and stuff like that.
Yeah, those things I heard. Mm-hmm.
And those work. And so we start off with a rehab, and the next step in the algorithm is medication. Now, when that doesn't work, patients usually come to us by then, and you might need an injection. And there are different types of injection you can do, and we have our program on injections.
Injection.
You like injection?
Love injections, man. Love them.
Right. Yeah, man. And so you can have a trigger point injection, which is an injection into the trigger point itself.
Yeah.
Or you can have what I do for patients that have nerve pain going down the leg, what we call radicular pain, or some people call it sciatica, X-ray guided, we call it fluoroscopic guided epidural injection. And it actually works.
I'm sure it does. But for our listeners, could you tell us the length of the needle?
Okay, so the good thing is we use something called fluoroscopy. It's an X-ray machine. And so we do not go into the spine. Although there are some techniques.
That would be painful, wouldn't it be?
When we do, I used to do some transforaminal injection, which is from the side, or we do caudal by your tailbone. But the needle it doesn't go into the spine. What goes into the spine, we use a contrast medication, which is like a dye, and we watch it flow on the machine on a little TV screen. So we don't push the needle per se up into the spine to where the problem is. We guide it carefully with landmarks on the body, and we use a medication, which we call a contrast, to show us where to go.
So it's like a long needle. Okay.
But the skin is numb. The skin is numb, so you really don't feel it. So we numb the skin. So when I'm doing the lumbar epidural steroid injection, we numb the skin first. And after I numb the skin down by the buttock area, what you really feel is pressure. You just feel me moving. And then you hear some beep, beep, beep. We're taking picture with the fluoroscopic machine. And then you might feel something, kind of cool or warm, depending on your sensorium or what you can feel, flowing. And then we're done.
Okay.
And then number 4 on the algorithm, when everything fails, you may need surgery. And we have some amazing spine surgeons in Jamaica. And for surgery, there are 3 main reasons that you should proceed to surgery.
Okay.
1, the quality of life is so bad you can't live. The pain is just excruciating. You cannot manage it, right? 2, there's something called cauda equina syndrome, where you start compressing the tail end of the spine, which is called the cauda equina. And the syndrome is where you start having bowel and bladder loss of control. You start, losing control of maintaining your bowel and your bladder. You start having accidents, right?
Okay.
And the other one is progressive neurological decline, meaning even if you have no pain, you start getting weaker and weaker. Like if you have a foot drop, your foot start getting weaker and you can't walk. Those 3 are indications for surgery. So that's a stepwise algorithm. And we always have to maintain the algorithm. Remember the algorithm. You don't jump to surgery. Because I've had some patients where,
Back being hot. So them just be like, oh, surgery, surgery right away.
I know. I've had patients where, I've had patients where I think they need surgery and they said, no, we can't do no surgery, inject. And I inject, because it's a 3-course injection, 1, 2, 3, 1 or 2 weeks apart. That's the international recommendation for the fluoroscopic guided injection. And you do the first one, they're halfway better. And by the 3rd one, I had a patient who few patients a lot of times, they're very inflamed. And at the end, when they walk in the office and walk out, they come and give you a hug. I had a patient who gave me a hug the other day in COVID. And she's an older patient. I said, "You're going to hug me? It's COVID." She said she still wanted to hug because she was able now to have better pain control. Yeah, man. So, I mean, back pain treatment is one of the things that I love. I really love to treat back pain.
All right. So, what lifestyle changes can improve a person's back health?
Yes, I like that question. I certainly like that question. So when it comes to spine health, the first thing is prevention. And we're going to come back to the exercise thing again, Alicia.
Oh, no.
You must always have... All right, so I did a presentation once at a conference about exercise. The best people to do exercise are aging people. Once you get older, you know why? Because as you get older, your muscle fibers, the number of your muscle fibers remain the same, but the muscle fiber size gets smaller. When the muscle fiber size gets smaller, they get weaker.
So what exercise it strengthens the...
It helps them maintain the size of the muscle fiber, which is essentially strength. Which is why you have those guys look like, see my biceps? Touch it.
No, you're going with yourself, you know. Whoa. Was not expecting that. Yeah, we're going to go to me. All right.
And so you want to maintain your endurance and your strength. And so you always have to exercise. That's one. Two, you ask me what else. You want to avoid activities that cause a lot of repetitive bending.
Okay.
And worse, bending with rotation. That's called torsion. The spine is weakest and most vulnerable with flexion and rotation. That's called torsion. And that's when you can injure the disc. So if you're going to bend and pick up something, bend your
knees.
Bend your knees and bend forward. Bend in your sagittal plane, which is like straight. So you don't want to twist. Even if you're bending your knees and go sideways, face what you're doing.
Some persons who are... Okay, so what about persons who... They're like in the car and they're trying to reach for something?
Yes, that's not good. That's absolutely not good. And that reaching back is notorious in women reaching for their handbag. You know what they get? Rotator cuff injury. I have so many patients, and it's the left side because we drive car on the right-hand side. And you reach back with your left hand and you get rotator cuff. But the spine health, so anything that does a heavy lifting, repetitive bending, long sitting. There's something called stretch break. If you can download it on your computer, you should get up every 20 minutes to 30 minutes, especially now that you
stretch. I do that. I do that.
You do that?
Yeah, I'm tall. It's hard for me to sit down for a very long time.
Yes.
Yeah.
And then most chairs, because of your height, your knee is supposed to be at 90 degrees and your hips at 90 degrees. But we're going to do a show on ergonomics.
Please and thank you.
You're most
welcome.
welcome.
So that we can know what that means.
Yes.
Okay, but thank you so much, Doc. So we spoke about back pain.
Yes, we did.
Acute and chronic and how you can improve your back health. That's all we have for today. Want you to join us next week. Thank you everyone for listening. Thanks to Power 106 and our show producers Renee, Stacy, and Jeff. All of our sponsors, Rehabilitation Institute of the Caribbean, Winchester MRI, Immune Active Denk, and Almighty Studios. We will see you all next week, Thursday at 5:30 p.m. Goodbye. Blessings.
Blessings, guys. Bye.